Now, Dr. Quinn, what are some of the most more common causes of hair loss that you see in your clinic?
There are so many reasons for hair loss, and it is becoming more prevalent where patients are asking me, Dr. Quinn, what is going on with my hair? It's falling out, and so many patients are coming in with this complaint, and it's causing them a great deal of anxiety and stress. And I want to note that anxiety and stress is noted as a reason for hair loss. That's one reason. There are so many reasons. Other reasons include uh, chronic autoinflammatory conditions like lupus. I've actually had a patient that had hair loss, and we did some tests, and it was determined that she did have inflammation. We referred her to a rheumatologist. She was diagnosed with lupus. She actually was treated for the lupus, which was diagnosed, but her hair loss was treated as well. And then there are other reasons, such as individuals with normal aging. As we get older, that hair does become less, as you can see with Dr. Quinn. But the take home is there are a lot of reasons you can have hair loss. And if you do, discuss it with your medical provider because treatments are out there and they're very effective for a lot of people.
Well, speaking of treatments, and a lot of us want to know this, what are some effective treatments and how do they work and how early should we start them?
Right. We talked about treatments. Well, the first thing you have to do is have that conversation with your medical provider. Let them know, that you're having the hair loss, and it's coming more frequently, more so than before at a very increased rate. That's important because that's part of the history. The medical provider can do an evaluation. Now, the first thing we have to come up with a reason. For instance, I had one patient that had hair loss because of her grooming practices. She was doing the braids and she was bringing them so tight that she was developing something called traction alopecia. And that's a condition where there's the mechanical force pulling those hair follicles so tight that they break off and then they become damaged, where she was having these parts that were getting bigger and bigger. So we helped her change her styling techniques. But then there's some treatments out there, such as oral pills for male pattern hair loss, where males can take. The most common is called Propecia. It is very, very effective. So there are a lot of treatments, but you have to let your doctor know what's going on.
What about those who are discovered losing their hair after contracting COVID?
That is so common. I actually did a great deal of research, and there's a high percentage of individuals that have had a coronavirus infection and they have hair loss. And what's being attributed is the fact that when you have a COVID infection, a lot of people have inflammation, and this could cause hair loss. But also the stress associated with a COVID infection can contribute to the hair loss as well. But the most important thing to remember is have a conversation with your physician because treatment options are out there, but you have to let the doctor know.
All right, Dr. Quinn. So this is more of a question for me, but I have thick hair, but my hair tends to just come down in wads after showering. Is there a tip you have for that, or is that just common stress?
Well, like I said, that's a conversation with your doctor, but there's so many reasons, but you got to let your doctor know because that hair, that's something we want to keep intact.
All right. Thanks so much for your time, Dr. Quinn.